Hi, my name is Katarina and I am a registered nurse here at God PPEC. Today I will be demonstrating how to properly set up a tube feeding and a feeding pump. First, gather your supplies. We have gloves, hand sanitizer, prescribed formula, and the feeding bag. Next, hand hygiene. Wash your hands thoroughly with soap and water and use hand sanitizer to reduce the risk of infection. Preparing the feeding bag. I will pour the prescribed formula into the feeding bag, making sure not to touch the inside of the bag or cap to maintain a clean technique. Hanging the bag. I'll hang the feeding tube bag on the IV pole above the level of the pump. This allows gravity to assist with proper flow of the formula through the tubing. Loading the pump. I will correctly place the tubing into the pump according to the manufacturer's guidelines. I will use the pump's prime function to fill the tubing with formula and remove all air. This prevents air from entering the patient's stomach and ensures accurate delivery of the feeding. Programming the pump. I will program the prescribed rate and volume according to the provider's order. This ensures the patient receives the correct amount of nutrition at the appropriate rate. Final safety check. I will verify that the tubing is free of air, all connections are secure, and the system is properly set up. This makes sure safe and effective delivery of the feeding. This completes the setup of the internal feeding system. All safety checks have been performed, ensuring accurate, safe, and effective delivery of the prescribed nutrition.
For more educational videos and helpful information, subscribe to the God PPEC YouTube channel today.